Today, we're going to talk about the best time for intercourse to maximize the chances of getting pregnant. Throughout a woman's menstrual cycle, cervical mucus goes through 4 main stages. During the first stage, the likelihood of conception is extremely low. In the next 2 stages, the chances gradually increase. The 4th stage is when cervical mucus indicates the highest likelihood of pregnancy. Let's look at how to recognize these 4 types of cervical mucus. The first stage occurs just after your period, when there is essentially no cervical mucus. The vaginal area feels very dry, and the chances of getting pregnant are almost zero, around 0.3%. In the second stage, the area may feel slightly damp, but you can't see or feel any mucus. Here, the probability of conception rises slightly to about 1.3%. These first 2 stages may not be noticeable for everyone, especially for women with shorter cycles. The 3rd and 4th stages are more commonly experienced. In the 3rd stage, cervical mucus becomes thick and sticky, sticking to your fingers. During this stage, the chances of pregnancy rise to around 2.5%. The 4th stage is when cervical mucus is thin, slippery, and clear, similar in texture to raw egg whites. It can be stretched between 2 fingers without breaking. At this stage, the chances of getting pregnant jump significantly, up to 28.6%, almost 30%. After the 4th stage ends, mucus may become thick again or disappear. Some women may notice thin mucus right before their period, but this is not related to fertility. The key takeaway is start trying from the beginning of the 3rd stage and continue for 3 days after the 4th stage ends. The 4th stage is when conception is most likely. This is the first method. There are a few other easy ways to identify your fertile window because every woman's body works differently, and cervical mucus can vary for several reasons. Understanding a few methods can help you pinpoint the most fertile days more accurately. During and just after your period, body temperature is usually slightly lower. When an egg is released from the ovary, a process called ovulation, body temperature rises slightly, around 0.2 degrees Celsius or 0.4 degrees Fahrenheit. If you measure your basal body temperature every morning before getting out of bed or doing anything, you can notice this subtle change. Here's a simple rule. After 6 consecutive days of lower temperature, look for 3 consecutive days of higher temperature. This marks the fertile window. It's important to measure temperature correctly. Do it immediately after waking up, while still in bed, using a digital thermometer under the tongue. Do not measure under the arm or with a regular fever thermometer, as they are not sensitive enough. This method doesn't tell you exactly when ovulation begins, but it does indicate when your fertile window ends. To use it effectively, combine it with the cervical mucus method. Start trying on the day mucus changes and continue until the 3rd day of the temperature rise. This way, you can maximize your chances of conception. Why is fertility higher at certain times of the month? Women have 2 ovaries, and typically 1 egg matures each month. Once the egg matures, it breaks free from the ovary and travels into the fallopian tube. Conception can only happen if a sperm is already present in the tube. If the egg is not fertilized, it eventually breaks down and menstrual bleeding occurs. Sperm can survive in the female body for about 3 days, sometimes up to 7, while a mature egg only lasts for around 24 hours. This is why it's crucial for sperm to be present in advance, so it's ready when the egg is released. Intercourse during these days is what defines the fertile window. Another method to track fertility is using your calendar. Mark the first day of your period, then mark the first day of your next period. The difference between the 2 dates is your cycle length. Track at least 6 months. Take the shortest cycle and subtract 18. That's when your fertile window starts. Take the longest cycle and subtract 11. That's when it ends. For example, if your shortest cycle is 26 days, fertile window starts on day 8. If your longest cycle is 33 days, it ends on day 22. Intercourse during these days ensures sperm are present when the egg is released. Common mistakes in counting cycles include starting from the last day of the period instead of the first day, or including the start of the next period. Always start counting from the first day of your period. There are additional tools like ovulation kits, which work similarly to pregnancy tests by measuring hormones in urine. Apps like Clue or Glow can estimate your fertile window if you enter your cycle data, though they're not 100% reliable. Some women notice mild pelvic or breast pain after ovulation, but these signs alone are not dependable indicators. Every woman's fertile window is different, and it may vary from month to month. Paying attention to signs like basal body temperature and cervical mucus can improve your accuracy. No method can guarantee pregnancy, but combining several strategies greatly increases your chances. Remember, regular intercourse every 1 or 2 days can lead to over 80% of couples conceiving within a year. Don't worry if you don't succeed in the first 3 or 4 months. If no success after a year, consult a doctor. Women over 35 should seek medical advice after 6 months of trying.